Hi, Dr. Gupta.
Hi, Heather.
Ontario reopening, Dr. Gupta. Haircuts and manicures and malls. Oh, my. What do you think of that? Here we are at stage 2.
Yeah, I think it's great. I think it's a sign of how far we've come, how well we've done with our vaccine campaign, how well we've done in reducing that third wave. And I think it's a judicious opening plan. You know, it's not overly aggressive. It's limited capacity, as you said, indoor retail, non-essential and essential, some personal services, a little bit increased capacity for outdoor.
Right.
People will still be wearing masks, and we're going to be observing what happens. That's the key.
Yeah, judicious is your word, and it's interesting from Ontario's new top doctor. He urged a prudent approach because Dr. Kieran Moore is the new top doctor in Ontario, and he had his first briefing yesterday, clearly under pressure to reopen even more quickly. But he wants that 3-week interval between stages because he said that is prudent. Would you agree with that kind of time frame and phased-in rollout?
Yeah, I think it makes a lot of sense. You reopen and you see what happens, particularly in the context of the fact that Delta has become the dominant strain here. And we know that soon after that happened, what happened in Israel, what happened in the UK is that they saw more cases. They saw a bump. So we can anticipate that we will get a bit of a fourth wave. Hopefully it'll be a much smaller wave. And hopefully, like in those other countries, there will be much less of a relationship between the number of cases and the number of hospitalizations and deaths. But we can anticipate that cases will go up. So we need to watch what happens as we open up. They've said this from the beginning, but we can move those timelines to reopening. We can move forward, we can move backwards, all depend on where the cases are, how many cases, and how we're able to trace those cases. So it makes sense.
You mentioned the Delta variant, and I just would note you were doing an explainer on this last night on the National, and if you follow Dr. Gupta on social media, he has a link to his information, and also, of course, on the National's YouTube channel and various social media sites as well if you want to find out more as you take a look at the threat it is posing across the country. One of the things, again, the tool that we've relied on through the pandemic, Dr. Gupta, again being talked about, and that is masks. When do we wear masks, and when do we not need to as the country opens up? For example, BC tomorrow, masks recommended but not mandatory. Alberta is going to reopen entirely tomorrow. Banff is looking at the issue today. Edmonton's lifting its mandatory bylaw tomorrow. Calgary in a couple of days, it's looking at that. So there are a lot of people questioning when and should and how do we even think about masks right now? What's your best guidance?
Yeah, really tricky, Heather. I'm not quite there yet because to me, the key is as we've improved in terms of our vaccination rates and case numbers have gone down, we want to be able to reopen things. We want to be able to stimulate that economy again, allow people to get out. But masking doesn't prevent that. You know, to me, masking really should be the last thing. We're able to open things up. We're able to get people into businesses, get people back to activities that feel more normal for them, but to maintain that mask. And it's kind of our last line of defense, particularly given that we know that the Delta variant is much more transmissible than previous variant. And that previous variant was more transmissible than parent strain. So we're dealing with a variant that's very, very transmissible. So to me, that really should be the last thing that we remove. We're still able to open up without removing that mask mandate. But to me, it's early to do that, particularly, again, in the context of Delta variant and what we're seeing in other countries. And it doesn't seem like it's necessary yet for us to do that.
Okay, something to consider when people have the option of wearing or not. As long as you're flying that Habs flag in the back of your office, I have a Montreal Canadiens question for you. Talking in reporting in our news that the team is asking the province to up the capacity limit in the Bell Centre for the home games. So up to half capacity, 10,500 fans for games 3 and 4. As a fan, I'm sure you get that. But as a doctor, when I look at your tweets, Dr. Gupta, you seem to have concerns.
Yeah, I mean, we all want to see fans at the game, but if you watch the games, Heather, by second period, a lot of people, if not the majority, have the mask, below their nose at the very least, sometimes just around their chin, or, it's in the heat of that moment, people are screaming at the top of their lungs. Masks come down. If you watch the coaching staff, they routinely will pull the mask down in order to speak to refs and players, which sort of defeats the purpose. Our coach, Dominique Ducharme, is home with COVID. That's the irony here. So We want to see more fans. It's a big space, but it's still an indoor space. People are screaming. People will congregate on the escalator, in the bathrooms, at the canteens. It's going to be very hard to keep people apart. So to me, having this arbitrary sort of 50% capacity in the context of where we are with Delta variant is a risky thing. I think there are safer ways to do this, and we want to fill that place up, but let's do it by administering a rapid test at the door before you go in, which would really reduce that risk. Or let's limit it to double vaccinated people, how they did early in the pandemic. So there are strategies that have been effective in Europe, but to me, to just open it up for 10,000 people to get in there where we are now with Delta variant poses quite a bit of risk.
Even as a fan. All right. Medicine trumps hockey allegiance at this moment. I want to ask you, capacity limits are increasing, mask mandates are falling by the wayside. Dr. Dina Hinshaw yesterday, Dr. Gupta, I'm not sure if you saw that, she gave her last regularly scheduled briefing. She'll come back if need be, but those daily COVID briefings in Alberta, they're finished as of today. And it makes me wonder, particularly, you look at the headline in a Globe and Mail column, Andre Picard, is the COVID-19 pandemic over yet? ? Can we answer that yet?
I mean, as you said, a lot of things are going in the right direction. We've closed the COVID ward at our hospital. All these things are really positive signs, and we are in a very good place. But when you talk about a pandemic, the pan part is important. It's the whole world. It's not over for the world. And the unknown, so first of all, there are a lot of people suffering in other countries, and other countries have very low vaccination rates in Asia, in Africa, in many parts of the world. The other piece, which is an unknown, which to me is the biggest risk, is that there will, in those places where there's lots of transmission, the risk is that there is a new variant that emerges that truly escapes the immunity conferred by current vaccination. If that happens, and that variant is also very transmissible, it will find its way back. That's the biggest risk we face. So in two ways, it's not over. One is that it's not over globally. It's never over until it's over globally. We have to think about that. And the other is that there's always that small risk posed by the fact that it's still present in other countries and mutating actively. So we're in a very good place. We should be very happy, very comfortable, but I wouldn't say to my mind it's over until it's really globally over.
Okay. Since we've had a hockey reference, let's go into overtime for one more question. And for a change, it's not related to COVID-19. I want to ask you, as a respirologist, people having such difficulty breathing right now in this extreme heat, and we're talking about sudden deaths, we're talking about a lot of health risks associated. What are the main things that you're concerned about with these unbelievable temperatures in the West moving east? And also, what should people do to stay safe?
Yeah, really important, Heather, because every year we see this, and we're seeing it more and more with climate change, the effect of extreme heat and heat stroke, and people dying, particularly vulnerable people, elderly people, babies, people who are underhoused, people who are in housing without air conditioning. It's not only the ambient temperature, it's also radiant heat from the sun. Stay out of the sun. It's also humidity. As the humidity rises, our body's ability to cool down by sweating is compromised. That's our mechanism to cool down. And once the humidity is above 75%, it becomes an ineffective mechanism. And as that core temperature rises, people will start getting dehydrated, start feeling lightheaded, start feeling nauseous, having muscle cramps. Those are the signs to look out for. You really got to get into a cooler environment. Once the temperature rises to 40 degrees, we call that heat stroke. And that can be associated with more serious things like agitation and confusion, and it can be a downhill road from there. So you want to avert it before that, at the point where you're starting to feel dehydrated. Really important to be aware that this can sneak up on you in the current kinds of temperatures we're seeing out west.
I really appreciate that as a bonus question as well, and our conversation as always. Dr. Gupta, thank you very much.